Connecting to server. All right. Hey, good morning, everyone. I hope the sun is shining where you're living as it is here in sunny South Dakota. And California is always sunny, right?
No, actually, it's pretty overcast today. It's all
Oh, you
cloudy.
got you got an overcast day.
Yeah.
Well, good. Well, welcome everyone to the Diabetes Reversal webinar. I am Joe Barton with Barton Publishing, and I'm excited for you to be joining here us today. Today we're going to kind of do an overview of the basics of diabetes and how to reverse type 2 diabetes specifically. So we're going to let people continue to hop on here. If you can, say hello in the chat. I'd love to hear from you. Tell us how you're doing, where you're from. Hey, Grace, nice to see you, Grace. I think Grace is almost here every week, so we love having you here, Grace, and others that are faithful in watching the webinars and asking questions and learning a lot of good information. So say hello to us in the chat. And I think, are we heading to Facebook, Leslie? Are you working on that? Working on it? All right. Good stuff. So Dr. Saunders, let's talk a little bit about the diabetes solution kit itself. I guess I'll start with a little bit of a story. So my company, Barton Publishing, I started about 16 years ago in 2004, and I used to be an accountant and not a health expert, which is why Dr. Saunders has been with me for all these years, since 2007, really, when we met at a marketing conference, actually. So we randomly sat down next to each other at breakfast. I think it was the second morning, and started talking a little bit and realized we were both kind of looking for someone like each other and didn't know it. So that was pretty cool how we met. And so over the years, I had been publishing books that I had written by other people on different health topics like acid reflux, how to reverse how to reverse or cure acid reflux with natural remedies. And we still have reports on kidney stones and gout and high blood pressure and yeast infections and gallstones and all different things like that. And one of the products that we published was about diabetes, and it was about the same time Dr. Saunders came on, and I didn't realize how big of a problem diabetes was for so many people. And we're talking, like, you talk about a pandemic of the coronavirus. What about diabetes? Like, there's 100 million people that have diabetes or pre-diabetes right now in America, somewhere around there. And that's like a third of our population. And if you take children out of that, like, we're talking half the population has pre-diabetes or diabetes or close to that. So it's a very serious condition. And we started seeing and realizing that our product, the Diabetes Solution Kit, was helping a lot of people, and there was a lot of interest in it. So the last several years, we have really focused our company a lot more on just mainly diabetes and helping people more and more. And so that's this product here, the Diabetes Solution Kit. This is, let's see, what version is this? This is, I think it's like our 8th printing or 8th version, like, that we've edited. And so each time we release this, it gets better and better. And Dr. Saunders learns new things, and we tweak things and we add things. Like this last time we added all about fasting. We talked about the keto diet and paleo diet and different diets and things like that. We added some new recipes. And so that's a little bit of the story, the background behind the Diabetes Solution Kit that we've been publishing and selling for over 10 years now, with Dr. Saunders' help, major help as our medical advisor. And Dr. Saunders has been writing for our Home Cures That Work online magazine that we publish every month. And if you're not familiar with that, homecuresthatwork.com, there's a plethora of articles that he's written, one every month, covering a different topic. A lot of them are related to diabetes. So if you're looking for more information and more writings from Dr. Saunders, check out Home Cures That Work. And I guess I should give the link away that I like to talk about bartonwebinar.com is the page where you can find all of our YouTube videos of these recordings of the diabetes reversal webinar, all of the archived videos, and links to our Facebook page, links to our products like our supplements, and links to Home Cures that work. So anyways, I just thought I'd give you guys a quick little background story of where the diabetes solution kit came from. And so, Dr. Saunders, today we're going to really just this is going to be a little bit more informal, but we're going to talk about diabetes type 2 specifically for the most part. And as you're watching, we'd love to have your questions towards the end of this. We'll have about 15 minutes of questions, if not more. But Scott, can you talk about your journey with diabetes and how you've helped people in that area?
Yeah, that's actually great. I went to UCLA Medical School and did a family practice residency program at Northridge Hospital in Los Angeles. And it was just like because I wanted to know everything, so I took the broadest education I could. And then when I was done with residency, I went to work for the county of Santa Barbara. And I worked in the county health clinic, and I did everything. I delivered babies. I did surgery. I put in, anyway, I did all kinds of, I'm not going to tell you all the gross details. But, and then I sat in my office giving out drugs to people, one after another. And these people with diabetes would come in with diabetes, and then I would give them drugs and they would come back with, they still had diabetes and their blood sugar was still high, and they were getting amputations of their legs, and they were getting blind, and they're getting kidney disease and going on dialysis. And I thought that would be horrible to do that. And there's got to be a better way. And so about that time, I became the medical director of a nursing home. And when you're medical director, you get all of the patients that nobody else wants, or that don't have a doctor. And they usually come in with lists of medications, like 10, 20, 30 medications. 30 is not an unusual number of medications. And we were taught that 6 medications is all it takes to die. You're more likely to die from your medications than you are from whatever disease they could be treating. So I was going, well, how can we pair these? And looking for answers. Okay, what can we do instead of this medication? What can we do instead of that medication? And getting them down. Well, it turns out that diabetes medications not only didn't help, that they often made type 2 diabetes worse. That I found out that diabetes was not what I was told. It wasn't a lack of insulin, that they needed injections of insulin. It was too much insulin. And so here we're giving these drugs that cause the pancreas to put out more insulin. And then we're giving injections of insulin, and it's making the problems worse. They're getting, what is it, dementia? I can't remember. Maybe I'm getting dementia. And they're getting more kidney disease and more amputations and foot ulcers and all those infectious diseases and problems. So I decided to start taking people off the medications and putting them on dietary restrictions and changing this and changing that. And I tried all kinds of different things. And then about this time, I ran into Joe Barton at a conference we just happened to both be at. It just happened to. I don't think there's such thing as coincidence. I don't believe in that. So I think the Lord brought us together. Yeah. And at exactly the right time, when he said, I'm looking for a doctor who knows something about natural ways of healing illness. And I said, I'm a doctor who knows something about natural ways of healing illness, who wants to get the message out to everybody. It was like, boing, there we were. So then he had already written the diabetes solution kit, or I think it was all written, right, Joe?
Yeah,
and
I
then
think it was,
and then he gave it to me to edit it, and I went through it, and I learned a few things. I go, oh yeah, we could do that. Oh yeah, that works great. And instead of the kind of haphazard way I had been doing diets before, we came on this three-phase idea of let's get the insulin resistance down first. Let's just completely wipe out the carbs, get insulin resistance down so they can start healing, because that's where it starts. So that was phase one. Phase one is, you know, get off the insulin, get off the drugs, get the insulin down so that you don't need so much insulin so that you can heal. And then phase two is working up, okay, how is your diet going to work? That's the individualization. That's how you get it. Everybody's going to be different. From phase two is going to make everybody on a different diet, different way of eating, different way of doing things, different timing. Everything's going to be different during phase two. And then phase three is the maintenance part. So, and it's great. It works. Thousands of people have done it. It works. I do it for my patients. Either I give them the book or I tell them sign up on get the online book. And sometimes I just give it to them in the office. And you know what? I know it works because I've seen it work many times.
Yeah.
It's awesome.
Yeah, I got my shirt on here. It says, "Let's reverse diabetes in 10 million lives." So I had this created. Oh man, I think it was a little over a year ago for the Traffic and Conversion Conference in San Diego. And this shirt's extra special to me because it was made by my dear friend Brian, who passed away suddenly on Thanksgiving this past year, which is just a tragic thing. He was only 49, but like I wear this, you know, in remembrance of him, but also just as motivation, as like a big goal. Like we do want to help reverse diabetes in 10 million lives. And this webinar that we're doing today is one way that we're helping to do that. We're just trying to get the information out, connecting Dr. Saunders with people and answering questions, clearing up confusion. And so if you have this workbook, the Diabetes Solution Kit workbook handy, I would love for you guys to just give us a little bit of feedback, if you could, in the comments in the chat. Tell us, like, do you have any pages that you use more than others that you've got dog-eared or, you know, highlighted? And I would love to hear, like, what's your favorite part of this Diabetes Solution Kit? So share with the chat. I would love to get some of that feedback. So let's talk about, you know, the phase one, phase two, and phase three. We're going to get to that, but let's talk about, you know, the beginning part that kind of we overlook a little bit, but like there's a part in here about getting started and committing, and it's, you know, my commitment. And so we talk about with defining your why, and, you know, I think this is important for us to talk about. And Dr. Saunders, can you talk about like the success you've seen for people that have like the reason why they want to reverse diabetes, as opposed to somebody that just says, I think I should, or I know it's good for me. Like, can you talk about like what's the difference? Where do you see more success in people that are committed and write things down and have a reason why, or not? I don't know. Go.
Yeah. There is a difference. Some people are very committed to their health. They want to be healthy. Other people have a different why. They have children, for example. And I talk to them about, you know, your patterns, and partly because of genetics, but the other part is going to be what your children grow up eating and doing what you do. So your habits will tend to come down to your children. So some people, for the sake of their children, they say, I need to fix this problem. I need to stop this, you know, to be the change agent in their generation, to not let this go on to the next generation. Other people are fear. And, you know, that's the thing doctors have always worked on mostly, is fear. Because fear sells better than anything else. It's a sales and marketing way of doing things. And if you've ever go to a marketing conference, they'll tell you that your first line is fear, whatever you do. If you don't do what I say, you're going to die. If you don't if you want to avoid a stroke, then you better take your blood pressure medication. Is there any truth to that? No, but it doesn't matter. The fear still sells blood pressure medication. And I know a lot of people who take it out of fear that they might get a stroke if they don't. And there isn't any correlation, but it doesn't matter because they've put that fear into us to tell us that that's the truth. So with diabetes, if I can make you afraid of something and I can say, okay, are you afraid of Alzheimer's disease? Oh, that would be the worst thing in the world. You know, my aunt had Alzheimer's, mom had Alzheimer's disease. I never want to be like that. Okay, then you better get your blood sugar normal, or else you're 10 times more likely to get Alzheimer's disease if you don't get a normal blood sugar. Okay, I'll do it. So very often we use fear. You know, if you know somebody who's been on dialysis, then you use fear that way or whatever. But and that often works, but it's not really. It's not as good. There's relapses when people are working out of fear. A better way to work is to have, like with your children, somebody you love. If it's a love-based thing, like because I love you, I'm going to sacrifice my favorite sodas. I've had so many people with that that out of fear they go, okay, that's it, I'm giving up everything. In fact, I'll tell you a story. My sister-in-law called me one day, and she said she was in her living room. She was going to sit on the couch, and she had this terrible chest pain, and she couldn't breathe. And she says, oh no, I'm having a heart attack. I'm going to die. And she looked over at her 11-year-old son and said, I'm going to miss everything. I'm going to miss his wedding. You know, all of this to go through your head so quickly, you know, that I'm dying and I'm going to miss my kids, all of their stuff, their graduations and weddings and grandkids and all that stuff. And she freaked out, and she called me and she said, I need to make some changes in my life and you need to show me how. And I'm like, okay, come over after work. So she came over that night to my house. And I said, okay, this is what you need to do. You need to sign up on our program. You need to commit to doing the program. And you need to do phase 1, phase 2, phase 3. You need to pay for the program. She goes, I'm not paying you for a program. I'll do the program. Just tell me what it is and I'll do it. Guess what? She hasn't done it yet.
Yeah.
She didn't commit to it. And even though she had that fear, like, oh no, I'm going to die. Now that the fear is over, it's okay. Whatever.
Yeah.
I was over at their house last week, and they were making cookies, and I'm like, hey, well, whatever.
I love what you're saying about the love versus fear, because I mean, I'm a marketer and I've been marketing for, 15 years. I used to be an accountant and, but I didn't realize that I actually love marketing because I love, trying to get people to persuasion. That was like one of my favorite classes in college. And it's like, in accounting, it's all about compliance. Like all you're doing is like, all right, here's where you have to sign this, and here's what you do here. But in marketing,
no, you have the fear of an IRS audit.
Oh, it's total fear based. But in marketing, it's more like creativity. And so I have the right side of my brain, whatever, left, right connection there. So fear is very, we've tested this in marketing, definitely people respond more to fear, but if you can figure out a way to connect with people and to get them to be motivated by that love factor, love of their family, love of others, and doing it, not just for themselves, but for others. I think that's really powerful. And I need to spend some more time thinking about that, how I can get that into our messaging, because that's really good and really powerful. And I know we've seen that in our customers when there is a connection with family members or with others, that just greatly increases their chance of sticking to this program. Because let's face it, it's not easy. You know, let's get into that. So phase one is tell people about it, and it's not easy. It's simple, but it's not easy. It does actually take a pretty big overhaul if you want to do it, if you want to stick to it. So talk about phase one, and you know, what does it really take to commit and get to phase two, I guess. So
Okay, so phase one might have different lengths of time depending on how far you are into diabetes. If you're at type 2 diabetes, if you have pre-diabetes, then it could be a really quick process. If you've had diabetes for many years and your insulin level is, I don't know, I've had people 160. Normal is about 5 insulin on a fasting specimen. I've had people in the hundreds. So depending on where you are, it'll be different. And the idea is to get the insulin down, because type 2 diabetes isn't too little insulin like type 1 diabetes. It's too much insulin. It's the opposite. So it's really unfortunate that we use the same name, diabetes, for two opposite illnesses. But the phase one is really for type 2 diabetics to get the insulin down, and it'll come down gradually. It's not something that happens overnight. It doesn't, you know, it's not quick necessarily. And the way you know is by measuring your blood sugar. And when your blood sugar gets into the normal range, now that's the big question, what's the normal range? Normal is less than 100. Optimal is between 70 and 90. And the more you can keep it between 70 and 90, the better off you'll be, the less chance of having any of the complications of diabetes. So, but normal is below 100. So when you start seeing normal numbers below 100, then you have to start getting off of whatever medications you're getting, especially insulin. Insulin would be the first one to go if you're injecting insulin, because remember, you already have too much insulin. And the object is to get that insulin down so that you don't have the resistance to insulin anymore. And that's the whole process of phase one. And the way we do it is by cutting carbs. And that's our first thing, because we looked at all the different ways of doing it. I was doing it all. Okay, you try fasting, you try this, you try that, different things. And you can't just tell people not to eat, you know. We got to eat. That's part of life. So what we did in phase one was said, okay, you can eat, but you're going to eat like a salmon salad, and you're going to have asparagus and broccoli, and you're going to have cauliflower and salads of all kinds, green salads, and you're going to put oil and vinegar on a dressing, not Thousand Island dressing or all those sweet dressings that they have. And you're gonna look at where your carbs are in your diet, and you'll probably be surprised at some of the things, like people that put ketchup on everything. They go, I eat carrots and I eat celery and I eat really good food, but I put ketchup on everything. Or even worse is barbecue sauce. Some people put barbecue sauce on everything, and that's pure sugar. It's like syrup. Mm-hmm. It's crazy how much sugar it has.
Hey, I just was thinking, I've got this box of Kind bars. So this is my favorite kind of snack. It's dark chocolate cherry cashew, but I think it'd be good to look at the nutrition facts, and I'm going to hold this up and tell me if you can read it. But let's go through this, and let's look at what do we learn from this? Because most foods are going to have something like this if it comes in a box or a can or a bag. Can you see that?
Yeah, glucose syrup, cashews, cherries, chicory root fiber, almond sugar, peanuts, honey, palm kernel oil, glucose syrup, cranberries, rice flour, raisins, unsweetened chocolate, cocoa, soy, lecithin, salt, natural flavor. So 3 different forms of sugar in it.
Yeah, and it's got 22 grams of carbs, 11 total sugars, 6 grams of fiber, 0 sugar alcohols, 4 grams of protein, 10 grams of fat. So it's not horrible, but the ingredients, like there's actually some stuff in there that is kind of sneaky. Like you look at this, you think, oh, that's like a good natural, some good ingredients in there. But you got to look close at this is what I'm kind of saying. And I'm
Yeah.
guilty,
So that's actually important, Joe, because often what they'll do for things like this, they'll call it healthy, and they'll divide up 3 different kinds of sugar. So they'll have corn sweetener and sugar and rice syrup, and that's all just sugar. And then they'll put agave nectar, and they have 4 different kinds of sugar, and they can put them lower on the list, but it looks like it's low sugar. When if it was all one type of sugar, it would be the first ingredient,
Yeah,
and
because they have to list the ingredients in order of like how much the most to the least, right?
Correct.
Yeah. So they've got cashews listed first, cherries, which cherries has some sugar in it, chicory, root fiber, almonds, but then sugar is number 5. Peanuts, they've got some carbs. Honey, so you got sugar, honey, palm kernel oil. I don't know if there's any sugar in that.
No.
Glucose syrup, definitely. Cranberries has a little bit. Raisins has some. Let's see. Yeah, soy lecithin, is that a sweetener? Or what is
No, that's
a
an
thickener?
emulsifier. That's actually
Okay.
good for you.
Okay. So yeah, there's like 4 different types of sugar in here that keep the ingredients down, down the list on the label, but yeah, you add them all together, it's like sugar is number 1.
So you said 22 grams of sugar in that in 1 bar. What that means is if you were on phase 1 of the diet and you had one of those, that would be all you could have all day long. That's it. You're done. You're done with food for the day.
Which might not be bad if that's the only thing you ate, but that's only 160 calories. Yeah. I mean, 160 calories, you're basically fasting but it would be better. Like you could eat a lot more food and feel a lot more full and feel better if you're eating more fat, because your calories are not the problem. It's the carbohydrates. And that's really the key, because what happens with your pancreas when you eat fat versus eating carbohydrates?
Oh, that's really interesting. The pancreas puts out insulin every time you eat. And fat doesn't really put out a significant amount of insulin. Protein actually puts out more insulin. You get more insulin with protein than with fat, clearly. But carbohydrates are much more, starches and sugars. And there's an enzyme in your saliva that makes starch into sugar. It's that process of breaking down the starch so it's glucose before it even gets into the stomach. And then there are taste buds or detectors in the intestine, the stomach and small intestine, that tell your pancreas how much sugar is there and how much insulin to put out. And so the sugars clearly put out a lot more insulin than any other kind of food. And fiber doesn't. So if you're eating fiber, it's actually really good for you. It grows good bacteria in your intestines.
Yeah. So we've talked a little bit about this before, but like, can you subtract the grams of fiber from your grams of carbohydrates to come to a net carbs?
Yeah,
that 20 gram level? Okay.
That works.
Yeah.
That works. In fact, the more fiber you have, the slower the sugar is absorbed and the less insulin you put out. So if you have something like eating, which is pretty high in starch, has sugar, starch, and a lot of fiber. So raw carrots, but because they have a lot of fiber, the absorption is slowed somewhat. And fat does that too, actually. Ice cream, somebody did a study comparing ice cream to watermelon. And so calorie per calorie, ice cream has a lower glycemic index, which is how much sugar, how fast the sugar is put out. Ice cream has a lower glycemic index than watermelon because watermelon is like pure glucose. It's rapidly absorbed, whereas the ice cream, because of all the fat in it, it's slowly let out of the stomach little by little. The sugar is slowly let out of the stomach so that you have a lower glycemic index. It's not better for you. I'm just saying it is a lower glycemic index.
There is I guess you could call it low carb or keto type of ice cream. I forget the brand of it now, but it's heavy in the fat and very low in the sugar sweetener. I think it uses our artificial sweetener. I don't remember what kind, but I did have a little
Yeah,
bowl of it a while ago. Yeah.
they use sugar alcohols like
Yeah.
sorbitol and erythritol.
Are sugar alcohols any better than the other types of low calorie sweeteners?
In a way, yes. If you get too much of them, it causes diarrhea because they're not absorbed and they change the bacteria in your intestines. So if you eat them occasionally, if you have occasional like sorbitol sweets, suckers, or whatever, the ice cream stuff, that's okay. But people who do it every day, they actually change their bacteria to not a good type of bacteria. So it causes dysbiosis.
Yeah, I've noticed I can't have much for sugar alcohols. Otherwise, my wife makes me sleep out in the doghouse or something out in bed. I have pretty bad
Yes, of
gas. It
course.
doesn't take much. So some people can tolerate that more than others, I think. All right. Well, hey, this has been good discussion. And for the sake of time, we have quite a few questions that have come in. So I wanted to get to some of those. So
Let's
Larry,
do
hi
it.
Larry from Texas, and he is wondering if, let's see, he's taking a Dr. Oz blood balancing supplement. So Larry, you might want to add to your question. Tell me the ingredients in that other blood balancing supplement you're taking, because your question is whether you can take that in conjunction with Simichrome. So just want to learn more about the ingredients in that. So we'll wait for you to tell us more about that. Krish has a question. When will you be conducting a webinar, Dr. Saunders, dedicated to ARSC, adult repair stem cells? This topic will be extremely useful to all the participants, and it is my view.
Oh my gosh, that is so funny. I'm writing an article for the June Home Cures That Work that Joe was just talking about stem cells and exactly what needs to be done and why it isn't working, why so many people are getting stem cell injections and they don't work, and what we can do to fix that. Because in the research, it's amazing. You know, they inject stem cells into the hearts of, they did dogs at first, but now they've done humans. They did 17 humans, and it reversed their heart disease. It repaired the scar tissue that was in the heart became muscle tissue. It like the stem cells became muscle. And what's really cool about that, when they biopsy that muscle, it is like young. It's like an 8-year-old or a 5-year-old heart. It's like brand new heart. It's not like old heart muscle. It's new heart muscle. It is amazing. So yeah, we're going to do one on stem cells.
Awesome.
We're going to do that. It is awesome.
Good timing, Krish. Thanks for asking. It's almost like we planned that ahead of time, but we didn't. So yeah, that's cool. So maybe in the next week or the week after that, we'll have that'll be our topic is stem cells. So I'm definitely interested in that as well. So that'll be great. Let's see. So Larry said, I'm seeing progress with my diet and Simichrome supplement. When can I approach my physician to take me off metformin and losartan for blood pressure? Larry Maddox. So
okay. So when can you get off them? Okay. When your blood pressure starts getting below normal, then you need to get off of those. So it starts off one at a time. So if your blood pressure is less than 120/80, then you get off, then you call your doctor and say, look, my blood pressure is getting low. I'm really worried about this. Low blood pressures, that's where people get dizzy and fall and faint, and you don't want any fainting spells or anything like that. Don't wait until you're passing out and getting dizzy. Say, look, my blood pressure is below normal and I'm getting a little concerned about it. Can I get off of this? Which medication should I get off first? And then as your blood pressure is coming down, because it's down, especially when you're on during the phase 1 program, then you keep following your blood pressure over time, because it'll generally, when you get off the medication, it'll go up a little and then it'll come back down again over a period of about a month. And then as it's dropping down lower again, you call your doctor again, say, I'm getting low. My blood pressure is getting low. I'm a little concerned about this. Is it okay to get off of this last medication? And so, and they'll tell you whether you have to wean off of it or just stop it, depending on which medication. The calcium channel blockers, you just stop. You don't have to wean off of those. But some of them, like beta blockers, you might need, like, there might be other reasons you're on it, like slowing the heart rate or tremors, or there's other reasons for being on some of these medications. So that's why you have to work with your doctor.
Yeah, good. And Larry, also, if you find our YouTube channel, if you go to bartonwebinar.com, we've talked about metformin more in other webinars. And so if you want more information on that, you can hear more what Dr. Saunders had to say about that, and also with working with your doctor to get off medication. So that reminds me, we should probably do a quick disclaimer here about this webinar. It is for informational purposes only. This is not, diagnosing, treating, curing any diseases or anything like that. This is for you to get ideas from, and then to work with your own healthcare professionals to work on reversing your diabetes and making, doing that. Because Dr. Saunders is not your doctor, and each person is different. And so we need to say that to make sure that people aren't going to blame us if they do something silly. So. All right. So great question, Larry. And next one is from Renee. Hi, I have some questions on the Nervala supplements. Please, here's Nervala. And so number one, does it help cranial nerve pain? Because I read on the website it's for peripheral nerves.
Yeah, the central nervous system is a little different. The reason it's for peripheral nerves is because the problem in the peripheral nervous system is circulation. Primarily, it's getting enough blood to the nerves that all the way down into your feet, where the blood vessels, as they constrict more and more with diabetes, they actually get damaged on the inside. And the vitamin B1 in the benfotiamine, that special form of vitamin B1, it's a fat-soluble form, repairs those nerves and improves the circulation in the peripheral nervous system. But that's not the problem in the central nervous system. It's a different problem. So it doesn't work for the central nervous system. The only way to fix the central nervous system is to get the insulin down, to get your blood sugars into the normal range. And people, they need to get into the 60s and 70s, their blood sugar in the 60s and 70s, in order to increase the number of, they're called GLUT1 proteins that transport, they're transport proteins that transport the sugar into the brain. So the lowering your blood sugar, which is our phase 1 program, is the most important part for the central nervous system. That was the best question I've ever heard. That was such a good, because it really is different. It's not the same thing.
Yeah. Well, hey, Renee, congratulations. That's the best question he's ever heard. So that's and he's never said that before. So that's awesome. Next question is, can I squeeze out the supplement, talking about Nervala, can I squeeze out the supplement from the gelatin instead of swallowing it as a pill? And so I will just say, hey, let me just do that real quick. Let me pull apart. This is falling into my water. I'm going to pour a little in my hand. And Dr. Saunders, is it okay if I just take this out of the pill?
Yeah.
Okay.
Yeah,
I'm going to lick my finger. It's actually, I can't taste anything. There's a little bit of a, okay, it's not the best tasting. It's a little bitter. So
yeah. It's an acid. Alpha lipoic acid. Lipoic acid is That's funny.
All right, I don't recommend
it took a
that.
minute.
Keep it in the pill or put it in some milk or some cream or something like that. So yeah, that's a little strong.
Put it in your smoothie.
Put it in your smoothie. All right, you never know what you're going to get here on live on that. I mean, you can do it, Renee, but it's a little harsh. All right, next question. Eric, is asking, is drinking apple cider vinegar counterproductive to pre, pro, and postbiotics? Should I avoid the ACV?
Huh. Wait, wait. Say that first part of the question again.
Is drinking apple cider vinegar counterproductive to
Counterproductive.
probiotics
Okay.
or probiotics?
No, it's not. No, you don't have to avoid the ACV at all. Apple cider vinegar is actually very good for your intestinal flora, and the acetic acid is changed pretty quickly. It's an organic acid that will be absorbed mostly. It won't go down into the large intestine and affect the bacteria, it's fine. Yeah, no problem.
Well, I'm glad you asked, Eric. That's a good question. We're actually in the process of creating our 5th supplement, and it is specifically for acid reflux, and it contains apple cider vinegar in it. That's like the number 1 ingredient. So
yeah,
and it's also got.
Okay, Joe.
Yeah.
So I have the ingredients to the Dr. Oz blood balance.
Okay.
And it's white mulberry leaf, juniper berry, biotin with chromium, berberine extract, bitter melon, cinnamon bark powder. So it also has cinnamon. So that's probably why they're asking about can they take those together, because it also has cinnamon bark powder and also has chromium. But the chromium here is pretty low, 100 micrograms, and the cinnamon bark powder is also pretty low. So it's quite a bit less than what's in the Simichrome. And if you're taking 1 Simichrome a day, there is no problem with taking this one with it. Yeah, and it will also help lower your blood sugar. There's the other things in here, bitter melon, berberine, have been shown to lower blood sugar as well. So yeah, so the Dr. Oz, you can take those together if you want.
Yeah, but so let's talk about Simichrome a little bit. And here is a bottle. Let's see, I don't know if I'm on the video or not, but Simichrome has 6 different ingredients in it. And really, Dr. Saunders, you formulated this for people with blood sugar issues. And, you know, the amount of cinnamon and chromium and vitamin D, vitamin K, selenium, and vanadium, it really comes from research that you've studied and found that, like, these are, I don't know if you call them clinical dosages or the right, you know, they're formulated with the exact amount to be most helpful. And so, like, you don't necessarily need a bunch of other, like the Dr. Oz supplement might be fine, but like Simichrome is going to have like pretty much all you need in it for that, along with the
exactly
dietary recommendations.
Exactly. And so it was formulated so that people could easily switch off of medications and start taking that. And the reason is because the medications are not going to improve your condition, whereas this will improve your condition. You will actually get better insulin sensitivity from this because you're using the normal way your body is sensitive to insulin, like vitamin D actually is sensitive to insulin. Selenium is really important for glucose utilization. Chromium is really important. Without chromium, you could actually get diabetes if you were deficient in chromium, just because you're deficient in chromium. So for all those reasons, this is going to improve your function, your ability to be insulin sensitive, as opposed to the medications, which won't. So it was formulated so you could just go off like something like Metformin, just off it entirely and start the Simichrome right away. And that works.
Great. Yeah, if you go to bartonwebinar.com, you can see a link to order Simichrome if you'd like, and Nervala as well. Just a heads up, Nervala is actually out of stock right now, so we've got a shipment coming, but hopefully in the next week here or so, but we're currently out of stock. So I have a follow-up question from Renee regarding the she asked about the cranial nerve versus peripheral. She said she doesn't actually have diabetes, but she's got nerve pain in my trigeminal nerve from a brain tumor. So Is that any different, and can Nervala help trigeminal neuropathic pain that is not from diabetes?
Okay. The answer to that is I don't know. Yes, possibly. People have cranial nerve problems. I usually give them Nervala on top of injections of vitamin B12. It seems like a weekly, well, I start out with daily, like five days in a row, injections of B12, and then once a week after that, for about a total of 10 injections, because that decreases inflammation in the nerves. But if there's a tumor there, then that's obstructing or pushing against or creating a break or a problem with the nerve, then the getting rid of the tumor is the only way to fix that problem. In other words, you're not going to find a supplement solution for that kind of a problem.
Yeah. Yeah, that's a good question. All right, so here's a really good question from Steven. If I suddenly start to shake, it is a sign of low blood sugar, and should I take honey or orange juice urgently, or what do you recommend?
Okay. If you're injecting insulin, if you're using exogenous insulin and your blood sugar starts being really low, then you need to bring it up. So you don't want your blood sugar down into the 20s, where you can get seizures and go into a coma. That's really, really dangerous. So low blood sugar is dangerous when it gets into like below 30 kind of thing. But for most of us, if you're not injecting insulin, the best thing to do if you start getting that is stop medications, because some medications will cause that, especially glipizide, glyburide, diabeta. Those medications can lower the blood sugar too much and cause hypoglycemia. But if you're not taking any medications, you're not injecting insulin, then that time when you get sweaty and shaky from low blood sugar is actually, I'm sorry to say this, it's really good for you. It's so you don't have to do anything, but if it seems like it's getting too low, I usually tell people to carry like some, if they start having this kind of a problem, to carry some almonds or peanuts around and eat those, or those little baby carrots, the little raw carrots. Those are great too. And it's a lot better than drinking the glucose water or having a sugar syrup or something right away, because then that shoots the sugar up, and then you release a bunch of insulin, and then it drops low again, and then you're chasing it all over the place. And I've had people do that, chasing their blood sugar all over the place. Whereas if you eat something like carrots, then you'll start absorbing the carrots, the blood sugar will come back up, and it'll be a gradual thing, and it'll keep it up over a long period of time. Good question.
Yeah, orange juice is one of those 3 drinks to avoid that we talk about in our marketing, and a lot of people but if you think about it, like, yeah, people do use orange juice to quickly raise their blood sugar, and so that's kind of a sign on why orange juice isn't necessarily very good for you. So let's see, you got a couple more questions here. We're going a little bit longer today than usual, but I think Dr. Saunders has another 5 minutes or so. So let's get one more question in here. This is from Sir William. I have been on insulin since 2015, and until last week was taking 20 units a day. I also take Metformin 1,000 milligrams twice a day, and Invokana 300 milligrams once a day. About 4 days ago, I stopped taking insulin. My fasting blood glucose is now 9 to 9.9 daily. Should I go back on insulin?
Fasting blood glucose is 9 to 9.9. I think that's hemoglobin A1C would be 9 to 9.9 because some places they use the finger stick to do it and a rapid hemoglobin A1C test. 9 to 9.9, that's pretty high. Should you go back on insulin? That's a great question. The answer to that is you would be much better off if you would start the phase 1 program of the diabetes solution kit, because that to get that blood sugar down is much more useful if you do it with diet than if you do it with medications, because medications will gradually make it worse, whereas if you do it with diet, it will gradually improve it. For the time being, the 9 to 9.9 isn't a problem. Over a long period of time, it is a problem. But if you're doing that if you're doing that, and then you start phase 1 of the diabetes solution kit, and it's going down, it should be down in the 7s within a month or so, and then down to the 5s within 3 months. That'd be great. Yeah.
Yep. Okay. One last question from Renee, and I think we'll stop after this. But Dr. Saunders, can a person have a consultation with you and pay for your time? And I know the answer. So if you could just share like your office's phone number. We talked about this last week on our webinar. So if you want to give out your office phone number where people can call you and talk about that.
Yeah. Yeah, you can call Mariah or Andy. The number is 805-688-7171, and ask them to set up an appointment. There are various ways. Because of the COVID-19, I could actually bill insurance for phone calls now. But we do have a membership program. During the time that the people are on our program, it's $49 a month. There's no limit. If you only need 1 month, then just 1 month. If you need 2 or 3 or whatever. I have people that are on for years. I haven't talked to them in years, but they go, yeah, I want to be available. So that works fine. So it's 805-688-7171.
Yeah, honestly, that $49 a month is probably like the best value in the history of healthcare ever, I think. And like, I told you before, you're not charging enough, but I mean, it's worth way more than that. And I've been using that with my family and our team for many years. And, I mean, you can tell just by watching him on these webinars, how great of a doctor is, how much he cares, and how much he knows to getting to the root cause and the source of what's causing these symptoms that people have. So highly recommend. Leslie, thank you for putting that number in the chat. And anybody that wants to talk with him personally, you can call his office and set up an appointment. I highly recommend that monthly program that he has. So with that, we're going to wrap up here. Thanks to everybody so much for all the great questions and interactions, and thanks for I'm thankful I didn't die from drinking that Nervala powder. So it's like, oh yeah, that is an acid.
Died. It's an acid.
Yeah, better to keep that one in the capsule. So so good stuff, everybody. And we're going to be here next week. We may be changing the time of this to change things up a little bit and to get some other people that can join us. Instead of 10 a.m. Tuesdays, we might switch it to a little bit later on Tuesdays. We might, I don't know, we're talking about that. So we'll keep you posted by on email as well as on our Facebook page. So if you visit bartonwebinar.com, and you can see all the links there to our Facebook page, our YouTube channel. We'll keep you updated as well, and keep checking your emails and all that. So, all right. Thanks, everybody. Thank you, Dr. Saunders. And we will see you next time.
Okay. See you next week.
All right. Bye.